Hi, I'll be presenting case study number 7. So Dave is a 56-year-old Asian man with a medical history of lymphoma who is presenting to the nutrition department for education and assistance in preventing weight loss and malnutrition. He was diagnosed 3 months ago with lymphoma, and he has completed 3 out of 10 initial chemotherapy treatments. He has maintained a stable weight so far throughout the first 3 treatments. His oncologist has informed him that the treatments will become more difficult each time and advises him that if he begins losing weight, then he will have to take an appetite suppressant. Dave has no other significant medical history. He is otherwise healthy and his current weight has been stable. There is no significant family history relevant to his weight loss concerns. There are no significant cultural or religious restrictions that would impact my dietary plan of action. He has been very anxious about how chemotherapy will affect his body, and he is fearful of losing weight and muscle mass. Dave is employed. He can perform all activities of daily living and food shopping, and he can prepare his own meals at home. There is no current alcohol or tobacco use. There's also no current medications other than his chemotherapy treatments. Dave is reluctant to take the appetite stimulant. He prefers not to take meds, and he would prefer to maintain his weight and muscle mass by dietary or lifestyle means. The physical exam found all systems within normal limits with no significant findings. I find him to be willing and eager to get nutrition advice, and I believe that he will be compliant unless he starts to get severe nausea. There are no known food allergies or intolerances, no known medication allergies. His weight has remained stable through the first 3 chemotherapy treatments, and his labs are currently within normal limits. My plan is to compute his BMI and body composition using a bioimpedance scale to establish a baseline. I will compute Dave's daily energy requirements based on his normal activity level. I will also have Dave conduct a 24-hour food recall, and I will have him keep a daily food diary so I can track his calorie input against his energy needs. I will meet with Dave once monthly to assess appetite, eating habits, weight loss, and body composition. He will have labs done monthly, and we will go over them and his food log to ensure that there are no nutrient deficiencies. If there are any significant changes, we will modify the diet plan as needed. I have prepared a nutrition guide for him with tips on reducing nausea during treatments and meal and snack tips that will increase his daily protein and energy intake with smaller, frequent meals to reduce nausea and improve appetite. I have provided him with resources on healthy eating for cancer, healthy meal preparation tips, services that he can apply to for at-home meal delivery if needed, and stress reduction techniques and strategies that will help with anxiety and also help reduce some of the physiological stress caused by cancer and treatments. If Dave starts losing weight and he has lost more than 5% of his base weight, if we deem that our dietary plan isn't sufficient, I have informed him that the use of anti-nausea or appetite stimulant medication might be needed in the future, possibly only short-term until his weight stabilizes. And that's our current plan of action, and we will meet again in a month to assess where Dave is at with the next treatment. Thank you.